Welcome to Medicinavio. In this video, we will discuss about atherosclerosis. Now, what is atherosclerosis? Atherosclerosis is a progressive disease of the intimal layer of the artery, mostly involving large and medium-sized arteries, and it is characterized by lipid-rich lesions called atheromas. Now let's discuss the pathophysiology of atherosclerosis. Suppose this is the wall of an artery, and now we will discuss the layers of the arterial wall. The innermost layer, which is surrounding the blood, is the endothelium. Beneath the endothelium we have the intimal layer, and beneath the intimal layer we have the tunica media, and the outermost layer is the tunica adventitia. Now what happens is that there is chronic endothelial injury, and this chronic endothelial injury may be due to hypertension, smoking, or certain toxins in the body, or sometimes the endothelium is damaged even due to some viruses. Now, after the endothelium gets injured, there is accumulation of monocytes and platelets on the injured endothelium. This is because of expression of certain factors on the endothelium layer. Now another thing happens due to the endothelium being injured. There is increased permeability of the endothelium layer. Now, as a consequence of increased permeability of the endothelium layer, what happens next is that the macrophages or the monocytes, they leak inside the intima. Now monocytes, when present in the blood, they are normally called monocytes, but when they enter any tissue or even the wall of the artery, they are known as macrophages. So after these monocytes leak into the endothelium intima, they become macrophages, and these macrophages, they actually cause some release of certain factors which will cause smooth muscle cell migration from the tunica media, that is the layer which is present beneath the intima. Now tunica media consisted of smooth muscle cells. Those smooth muscle cells will migrate into the intima under the influence of certain growth factors released by the macrophages. Now we will discuss how these macrophages engulf the lipids. Now, certain fatty acids and lipids have entered the intimal layer due to the increased permeability of the endothelium. Now this lipid is now taken up by the macrophages and the smooth muscle cells. Now when the macrophages, they engulf these lipids, they come to be known as the foam cells. Also, there is migration of T lymphocytes inside the intimal layer. This is under the influence of cytokines released by the macrophages. Now, what happens next is that there is accumulation of lipid or extracellular lipid more specifically inside the intimal layer. There is also accumulation of collagen. This collagen is formed under the influence of the growth factors, which are in fact released by the macrophages. Now, this accumulation of lipids, macrophages and collagen ultimately forms atheroma and blocks the blood vessel. Now, we will discuss about the risk factors of atherosclerosis. Firstly, it mostly affects age group of 40 to 60 years, and mostly it is affecting the males more than the females. The next risk factor is genetics. Now, some individuals have a genetic predisposition to atherosclerosis, and this may be due to some metabolic abnormalities due to which there is hypercholesterolemia or increased cholesterol in the blood, or there may be some other disease which may lead to, like diabetes, and this may ultimately complicate the atherosclerosis. The next risk factor is hyperlipidemia, and this is characterized by increased lipid in the blood. This mostly occurs due to intake of high fatty diets like butter and hydrogenated oils and other food items. The next risk factor we are going to discuss is cigarette smoking, and this increases the chances of atherosclerosis considerably. Atherosclerosis may also occur due to stress and in type A personality type of people. Now, what is type A personality? Basically, these people are very competitive and very stressful. They always stress about work and other stuff, due to which this atherosclerosis risk and other cardiovascular diseases risk may be increased. The next risk factor we are going to discuss is obesity. This needs no further explanation, as obesity causes increased lipid in the blood, and this may lead to atherosclerosis. Now we will discuss about the consequences of atherosclerosis, or what atherosclerosis may lead to. Number one, it may cause gangrene of the legs or peripheral vascular disease. This happens because if the atherosclerosis, the fatty layer grows too much and it blocks the artery, it may cause less oxygen supply to the tissues of the lower extremities, and this may lead to gangrene. Next, we have myocardial infarction. Now, myocardial infarction, popularly known as heart attack, may be accentuated, or the risk may be increased due to blockage of coronary arteries by atheromatous plug. The next one is cerebral infarction, popularly known as stroke. This may occur if the cerebral arteries are blocked by atherosclerosis plaques. That is, the lipid layer blocks the cerebral arteries. It can also cause aortic aneurysm. What is aneurysm? Aneurysm is the dilatation of the arteries due to weakening of the wall of the artery. Thanks for watching. Please like, share, comment and subscribe to Medicine Avio and press the bell icon for further videos.